Dr. Jelaine Berquist, social media editor for seminars in arthritis and rheumatism. I recently had the opportunity to speak with Dr. Anh Ho, pharmacoeconomics and health outcomes fellow at Western University of Health Sciences. She is the first author of the article, Impact of Biologics on Health-Related Quality of Life in Patients with Ankylosing Spondylitis, a systematic review and meta-analysis of randomized controlled trials. This is available in the June 2022 issue online. Keep watching for details regarding this article. Well, thank you for joining me, Dr. Ho.
Oh, thank you for having me.
This is really important work. We talk a lot about disease outcome measures as it relates to remission and low disease activity, but really, are we talking about quality of life? And that should be as important to us.
I agree, completely agree.
So would you mind walking through your study in terms of the purpose of it, the methods, the results?
Absolutely. So the recent study we've done, the title is Impacts of Biologics on Health-Related Quality of Life in Patients with Ankylosing Spondylitis. And it was a systematic review and meta-analysis study. So as you already know, ankylosing spondylitis is a chronic disease that affects people at a young age, and they have to suffer through a lot of pain and discomfort. And combine all of that together, like you said, it put them in a very low health-related quality of life. And when it comes to treatment, the FDA have recently approved, not recently, I guess they approved new novel biologics in the last decades for the treatment of ankylosing spondylitis. And the purpose of our study is to look into the effectiveness of these biologics on health-related quality of life of patients with ankylosing spondylitis. And the method is quite straightforward. We conducted a literature search on PubMed, Embase, and clinicaltrials.gov using a set of keywords, and we add filters for randomized controlled trials, English, adults, and human subjects. And then each author perform the study selection and literature review process, and we only included randomized controlled trials in the end. Other inclusion criteria are that the population or the patient with ankylosing spondylitis that follow the 1984 modified New York diagnostic criteria. And the intervention, of course, it has to include one of the biologics of interest. And the last inclusion criteria was that the health-related quality of life outcomes have to be included in the study. And then we perform data extraction on Excel and data analysis on a review manager. And for the results, what we found was that the data on health-related quality of life were limited. We had 16 randomized controlled trials, and that involved 3,481 patients in the final analysis. And the placebo-controlled and treatment-blinded phase ranged from 12 to 24 weeks. And so 3 measures of health-related quality of life were identified. The most reported measure was the short form health survey 36 items, or SF36. It was reported in 12 studies out of 16 studies. Another one was the European Quality of Life 5 Dimensions, or EQ5D. It was reported in 3 studies. And the last one was Ankylosing Spondylitis Quality of Life, or ASQOL, and it was reported in 5 studies. The data for these 3 measures, we grouped them together and analyzed them separately. So we analyzed the data from 16 trials, and the outcome was the pooled mean difference in the change of health-related quality of life from baseline compared to after treatment with biologics and after treatment with placebo. And what we found was that in patients with ankylosing spondylitis, health-related quality of life before and after treatment of biologics compared to before and after placebo, it was significantly improved. And the result was consistent across all three measures of SF36, EQ5D, and ASQOL.
Very good. Very good. Thank you so much for this important work and for running through that. I imagine as a pharmacist, you would counsel or help rheumatology treatment teams, treat patients. Would this at all change your advice to rheumatologists or rheumatology care providers?
Yes, I think so. Absolutely. So as a pharmacist, I am a research pharmacist, so I don't have that much interaction, unfortunately, with the with the care team. But this study, I hope that it will add an additional piece of important information regarding the patient's specific outcomes. So when it comes to choosing the option of treatment with biologics, there are two concerns, I think. One is that these biologics are mostly self-injecting medications or infusion medications. So if a patient or a clinician's concerned about adding another injection into a patient's life, would that worsen their health-related quality of life? And the study showed that it's not a concern. The study obviously showed that the opposite results, health-related quality of life when it comes to biologic treatments, significantly improved. And the second reason I hope this study is helpful is that biologics are very expensive medications. So I hope with the proof that these group of medication improve patient quality of life, it help a little bit in terms of the process of prior auth approval or getting reimbursement from payers.
That's what I was thinking about too, as you were talking is, okay, well, that's another step towards getting approval for medications to help our patients in the way that, we now know with good literature that actually does really improve their quality of life and how they can deal with their daily activities and their work and their families. So I want to thank you so much for this really important work. And it was wonderful to get to talk to you today.
It's wonderful talking to you as well. Thank you for having me.
For the complete article, please visit www.sciencedirect.com/journal/seminars in arthritis and rheumatism. If you're interested in more video content from seminars in arthritis and rheumatism, please hit the subscribe button. Thanks for watching.